Thank you so much, Daria. Hello, everyone. I'm going to speak in Spanish. I'm not sure if I can share my presentation, otherwise I'll send it to you, and then maybe you can share it. My colleague is going to share the slides in a second. If you want, you can already start your presentation. Go ahead. Okay, thank you so much.
Bueno, en mi presentación me voy a enfocar, como bien decía Daria, muchas gracias por la presentación.
Daria, thank you very much for this introduction. As you have very well said, I'm going to focus on two examples in Latin America and the Caribbean, and I'm going to show some positive examples to improve care services in specific contexts. I'm going to talk concretely about Bogotá in Colombia and Mexico City. And I'm going to share mainly the changes that have been made in these two countries and how care services have gone through a process, mainly in urban areas, but in some cases in Bogotá, it's being applied in rural areas as well. This is being done mainly from a gender point of view, even from a feminist point of view, I would say. And it's also focusing on social justice. First of all, I would like to share with you some general characteristics of what is going on in Bogotá right now. I would like to highlight that this project has been going on for 1 year. And I would like to highlight as well that this system was created during the pandemic. So the situation was really tough, very difficult, and this could have been an obstacle, but it also offers opportunities. When we talk about care, a tough situation is a good opportunity as well to talk about this kind of subjects with local authorities. I would like to say as well that this project was designed with one clear objective in mind. The idea was to alleviate the burden of unpaid domestic and care work carried out by women. This is, let's say, the main objective of this district system of care in Bogotá. This is thanks to the mayor, who is a woman, and who really cared about this subject. So the idea was to find a balance, a gender balance in care work. There were two more objectives. First of all, care work should be recognized and people who work in this area should be recognized, and working hours should be reduced. In Bogotá, like in many cities in Latin America that are also changing and are also considering how care work works locally, these systems, as I was saying, are being quite influenced by the gender balance agenda and by a feminist agenda. And this is due to the fact that for many, many years, we have had mainly women in this kind of work. So this is quite an interesting fact, and it's one of the reasons why there's not much equality in this area. Cecilia, I am terribly sorry, but my colleagues are having some technical problems with Zoom and they cannot share your slides, but we will share the presentation on the chat. Okay, no problems. So now I would like to present this district system of care in Bogotá. It is for people who care, but also for people who need care. So mainly children under 5, people with disabilities, or elderly people. So it is for both those who offer care and those who need care. One of the ways we apply this system has been called the districts of care. So how does it work? What we do is we work in different areas. We have areas that have been identified, and we try to make sure that people get care in their area so that they don't have to go far from home to receive this care, something like 20 minutes walk, not farther than 20 minutes walk. So the idea is to offer services as close as possible to people's homes, both carers and those who receive care. One of the reasons why we have done so is because we want to offer these services to as many people as possible at the same time. Those who offer care need to have the possibility to get training, need the possibility to rest as well. This is really, really important because care workers need to have time off to recover from that work. But at the same time, people who get care need to make sure to access that care in a convenient way. And we want to do it in a way that, as I said before, is as close as possible to their homes. So these care areas that we have developed have been used to reorganize the city. These areas of care want to take into account care needs when reorganizing the city. And I want to insist, it's not only for those who get care, but also for care workers. And if you check the website of the city of Bogotá, you will see how it's being done, how these areas are being organized. And it's done with a map similar to Google Maps, where you can easily see the services you can get, where they are, the working hours, and contact data such as phone, etc., so that you can get in touch with those responsible in an easy way. We also work with mobile units, mobile care units. This is a second strategy, a mobile strategy that allows us to provide care services in rural areas and in urban areas where it is not easy to create another system. The idea is to make sure that people who live in those areas can also access care work, even if we cannot create those care areas I was talking about in those rural areas or urban areas that are difficult to access. Of course, we don't want to reinvent the wheel. We're not trying to change everything. We simply want to apply this way of thinking to services that already exist. We don't want to start from zero because, of course, we have our budget constraints as well. It's obviously not the main obstacle, but we need a budget to offer care. So what we try to do is to reach a consensus locally in the area, regionally and nationally, so that we can create care systems that are more sustainable. Very shortly, I would like to refer to Mexico City. In Mexico City, the experience has been quite the contrary. There has been a huge development in Mexico City because now in the Constitution of Mexico City, the right to care has been recognized. And although this right to care is in this legal text, and it is clearly said that we need to create a proper system. The fact is that they don't have a budget to cover those services. And obviously, without money, we cannot create a care system that works. It doesn't matter, even if we can only spend a little bit of money, we need that little bit of money. One of the main difficulties that trade unions face is that, as it has been said before, as mainly women work in this sector, it is mainly organizations and trade unions that work with homes and with home carers who have tried to organize and to take action to make sure that that kind of work is recognized as a formal work. But unfortunately, healthcare systems have not helped in this struggle as yet. So I think that different trade unions should get involved and should work together. And I think this shows that, in fact, we still need to talk about care, and we should make sure that care is something that is out there, that the public understands, and that is seen as a public problem, as a public issue. I think that's the main challenge right now.